Great. So I will start with the first question, which is, can you just tell our viewers a little bit about yourself and talk some about what got you interested in water and your work at Aquaya?
Sure, thanks, Emily. I'm Rachel Peletz. I'm the executive director of the Aquaya Institute, and it's great to be talking with all of you because actually my start in water and sanitation was at UC Berkeley. 20 years ago, when I was an undergrad at UC Berkeley, I heard a talk by Professor Cara Nelson on water and sanitation in Mexico, and that really got me interested in this topic. I actually ended up working in her lab and working in Haiti with one of her graduate students on ultraviolet light disinfection. And then upon her recommendation, I actually ended up going to MIT for a master's in environmental engineering, and then worked in Canada for a couple of years with a nonprofit called COS, the Center for Affordable Water and Sanitation Technology. And really, felt like there was still a lot I had to learn, and ended up going back to do a PhD at London School of Hygiene and Tropical Medicine, with some field work in Zambia, and then ended up joining the Aquaya Institute, which is a non-for-profit research and consulting organization dedicated to improving water and sanitation in low-income settings. And I think maybe just to talk more broadly, one of the reason I got into this sector that was really eye-opening when I was at Berkeley and talking with Cara is just, how big the problem is that, half of the world doesn't have access to sanitation and the third doesn't have access to safe drinking water. It's just mind-boggling to think, it's still so many people are in that situation, and in the times that we are, where a lot of us don't think twice about those services.
Great, thank you. I will ask the next question. What are some common pitfalls or challenges when it comes to choosing how to measure water quality?
Thanks. Yeah, thanks. And I maybe can also just give some background on the Aquaya Institute has been working in water quality testing and water safety management for the last 17 years. That's really where we started in post-tsunami relief work in Indonesia and house of water treatment, and looking at how best to improve water safety. And I think one of the challenges with measuring water quality, I think there's two immediate things that come to mind, and the first is just that the resources are often the resources for managing water quality are often deprioritized compared to other activities. And so for a water service provider, a small piped system, they're in a lot of resource settings, they're often struggling to just get water to customers. In a lot of settings, it's intermittent water supply, so the water is not flowing all the time. Sometimes there's challenges paying their staff and other items. So, water quality testing is often not a priority. And secondly, I think one of the other challenges, which is related, is about accountability. And so, ensuring that the test results are actually going to, either customers or governments, and really getting used, and really having those government institutions that are, working together to ensure that the water quality testing is being done, and then those results are being communicated in the most effective way so that can be used. So those are a couple of things. I mean, there's many more, but those are kind of the initial things that come to mind. Of course, another thing is just about the technologies, and that we don't have, especially for microbial water quality measurements, there's this delay between when you take the sample, when you get the results, because of the required incubation time for water testing. And so, you don't know what the results are right then, you'll know what they were yesterday. And then, we face that also, here in California, with beaches and things. And now we have some predictive models, and that's actually an area where Aquaya is working more and more into, is how we can look forward, and think about climate resilience as well in terms of ensuring water safety.
Actually, I want to jump in and ask a little question since I don't know the answer. How long does it take, I guess, to grow the microbes in the water before, I guess, you can say whether it's actually clean or contaminated?
Yeah, it's a good question. Depends on what technology you're using, but we're actually right now currently piloting some new technologies in Juba and Sudan right now that may be as short as 6 hours, but typically it's more like 18 to 24 or sometimes multiple days if they're doing kind of a multiple test tube method. So that's but generally a day.
So with that, one of our follow-up questions is if the most rigorous water quality measurement methods can feasibly and sustainably be implemented outside of a research setting, and if not, we're wondering if there are alternative methods for measuring water quality.
I mean, a lot of the rigorous methods, for especially for microbial, and I think that's really where a lot of our focus is because of the public health risks associated with microbial water testing. A lot of these are being done in the field, in terms of MPN, membrane filtration technologies. I would say one thing I have learned is that there are some field kits available. WagTech and Hawk have made. Del Agua was one as well, that are kind of field kits that are often, the idea is that this is something that you can take and do the tests in whatever setting that's needed. From what I've seen in sub-Saharan Africa, and so I should also just preface with giving a little background on a program that we've worked on with 26 different governments in sub-Saharan Africa, looking at their microbial testing and constraints to testing. Really, we found that most of the testing happens, in the office or in a lab. Like it's pretty unusual that you're actually bringing this testing kit with you around to all the different field sites. So I think, in terms of the basic methods and with fecal indicators, E. coli, or thermotonic coliforms, total coliforms, those are really commonplace, particularly in big cities. So, like for example, Nairobi, where I used to live, I know the water system, this was years ago, but they were doing 9,000 tests a year. So, like a lot of testing was going on for fecal indicators. Of course, that changes a lot in rural settings. And so there's very minimal testing of point water sources, of boreholes, of other wells, things like that, or small pipe systems. So it's very unusual. In terms of more advanced techniques, like for other pathogens, I think PCR, again, more of that's being done for research purposes. That's not done so much in terms of just surveillance or ongoing operational monitoring. But we're seeing those techs, especially actually with COVID, we're seeing a lot of advancements in PCR, and that may become more commonplace in the water sector in the future.
You mentioned about working in like rural area that has a lot of challenges. So what are some skills and goals that you think that are necessary when trying to develop or work on effective WASH initiatives and to work in lower resource settings in general?
I mean, a lot of the same skills that are needed in any high income settings are also applicable. I think technical skills are really important and applicable skills. I think sometimes when people are interested in development work, it's important to think about having practical skills, whether that's engineering or others. I think also just flexibility and patience too, and openness to knowing that things are often done differently, and there's a lot to learn from all different contexts, right? And I'm still learning a lot too.
Thank you. So my next question is kind of touching on some of the points we discussed earlier, but I'm curious about how Aquaya is able to make evidence-based policy recommendations, and if there's like a line to toe between sort of that rigorous evidence that comes from rigorous research and then policy that's actually able to get buy-in and is implementable at scale.
Yeah, another good question, which, sometimes the link between our work and what happens on the ground, it can be long and not always as straightforward as you may imagine. Maybe it's best actually if I give you an example with this. So about 5 years ago or so, we were asked to do some research in collaboration with the Kenyan government on looking at improving sanitation for low-income areas in Kenya. And specifically, the idea was a cross subsidy. So would higher income populations be willing to have an additional tax on their water bills to subsidize sanitation in the urban environment, specifically, on-site sanitation, so not necessarily sewer, but other sanitation technologies. And we conducted research in a couple of cities in Kenya through this and found that, yeah, on average, people were willing to. This was all stated preference, so what people would say, which we know has its limitations, but yeah, on average, people were willing to pay roughly $1 on top of their water bill and per month and to improve sanitation in their community. And so through that work, that's something, this was 5 years ago, right? And so I think we started that work over 5 years ago, and then the paper came out probably, I don't know, 2-3 years ago or so. And then I just heard actually this week that this is something that the government we knew was piloting in a few other cities with our recommendations, and now they're looking at scaling up nationally, right? And so that's super exciting, and it's great to see that research is being translated into use. But I think often what happens is just the reality of we have project timelines that end, and we've kind of moved on, and we're not on the ground tracking what's going on as much. But I think that's where research partnerships come in. This one in particular, we are working with WSUP, Water and Sanitation for the Urban Poor, and that's they're really involved in terms of working with governments and more involved in the translating the research into the actual policy piece. So I think there's more that we can do in this space. It is something that at Aquaya we've been putting more and more emphasis on in terms of developing research briefs, one-pagers that are easier to digest, thinking about dissemination workshops or other events. Yeah, definitely a key part of our work is thinking about how the research is actually used.
You talked about working abroad and on the ground, and something that we're wondering, which I think you briefly might have already highlighted, is how do you make sure that this work is community-based and, in other words, it's targeting the population that you're trying to help and they're actually able to use, your research and methods to help them?
I think it depends on the program. And again, I think partnerships are really key, because we do have limited, we have staff on the ground. Most of our teams in Nairobi, we have teams in Kenya Kenya, Uganda, and Ghana and Ethiopia. But having those relationships with government, with other groups that have been there, that are more established in the settings, I think is really key to ensuring that work is serving the key populations. It's interesting when you mentioned targeted populations. I also, what flashed in my mind was we're also doing a lot of work on targeting the poor. And so that's a kind of a specific area of research it's also gained a lot of momentum through the COVID pandemic, is how do you actually identify who the poor are in a community. You know, some communities you could say, okay, everyone's poor, so, or everyone needs services, so you know, you're not trying to disaggregate within that population. But in others, you know, a lot of settings, there may be subsidies that are targeting the poorest, but not for everyone. And so we've done some research that actually just, we just had a paper accepted this week on this topic, in looking at different methods. So, you know, one way is you do surveys based on assets. Like, do you have, what is your roof material? Do you have a refrigerator? Do you have, you know, do you have a bicycle? You know, things like that. And then we've done survey based, but then also machine learning, kind of AI techniques using that, those assets. And then we've also done community consultation. So that's, you basically just ask the community to decide who's poor. And, you know, the idea is that they know best in terms of who's struggling. And so we've done kind of a combination of these different techniques and weighed kind of benefits and pros and cons of the different ones to think about what makes sense in different settings. And then as a next stage, we're planning to roll out water subsidies in collaboration with a local partner, a water enterprise that's in Ghana, and looking at these different targeting methods.
Yeah, that's amazing. And I think it combines a lot of different interests. So it makes me want to ask, how do you think, you know, for those who want to get involved with work like this, how do you think they can start? You know, it might be hard to know where to begin. What do you recommend?
Yeah, also a really good question. It reminds me of my days at Berkeley and trying to navigate this space as an undergrad. A couple things. I think one thing that's really important is you know, talking to people, just actually doing what you're doing, and you know, reaching out to people in the sector. I think early on in my career, I probably didn't recognize how important those connections can be in terms of finding opportunities. And you know, you never know how people will pop up later in your life. Like, probably, I mean, who knows? We'll probably meet again in a few years at some conference or some, you know, collaboration. I wouldn't be surprised how things evolve. So that's one. You know, don't be shy to kind of reach out and talk to people and just learn about what they're doing. I think that's, you know, that's great. And the other thing I would encourage is to get field experience as well. So, you know, I know sometimes there aren't tons of opportunities when you're starting out. You know, you may be volunteer based, it may, you know, but I think just kind of getting your foot in the door and getting time in different countries, in different contexts, and really, you know, that really helps you understand kind of how things work. Like there's often a lot of kind of underlying systems or you know, realities on the ground that that you may not realize. For example, early on in my career, I didn't realize how much intermittent water supply was an issue. I mean, now it's maybe more talked about, and maybe that's part of the education system, but you know, I didn't really realize that till I was traveling and working more internationally and realizing, yeah, the water is out for a lot of the time. And you know, I was, for example, during my PhD, I was based at the largest hospital in Zambia, in Lusaka, and the water would be out all the time. And it's like, okay, if this is in the capital in Zambia, you know, at a hospital, you know what, you know, this is kind of where the services should be the best in the country. And if it's not happening here, then it's, you know, it's likely not happening and a lot of the other places. So I think, you know, that's the kind of thing that you may not really realize. You might not also realize kind of the impacts of that when you're sitting in Berkeley or other, you know, other settings. So.
Yes. I know you mentioned a lot of work at Aquaya and a lot of interesting work. So what is a success or full circle moment Aquaya has experienced that you are proud of or feel that is very impactful in showing the importance of WASH interventions?
I probably would have actually said the one I already talked about in terms of subsidies. But I think maybe I'll, since we have some time, I'll also talk some about some of the other work that we've done, also related to subsidies, but on the sanitation side. And this is a project that we were working with UNICEF in Ghana, and we also actually had a paper that just come out in the last month on this topic as well, where, you know, I think one thing I'm really proud about this project is how we were able to work with UNICEF and integrate research into their implementation activities. So UNICEF was rolling out a sanitation subsidy program, where basically they were subsidizing toilets for poor populations, which were determined through community consultation. This was a separate but complementary project to the one I mentioned before about subsidies. So, you know, I think just working with them on that, we were able to integrate a randomized control trial into their research. So we had a control group, and we were able to, you know, really rigorously study the impacts of subsidies. And these were all in communities that had already received community-led total sanitation. So, you know, they had kind of already gone through this behavior change, which is a behavior change campaign to encourage sanitation in these communities. And then the idea was that the subsidy was layered on to target the poorest, and, you know, those people that maybe hadn't made that leap to have safe sanitation. And I think, you know, I think one thing that we found that was really interesting was that just how common it was that toilets would collapse in these communities. And so, you know, even throughout the couple years of our program, you know, the number of people that were open defecating went from, you know, roughly a quarter in the areas, in the control areas, you know, they went from roughly a quarter to 60% because of all the toilet collapsing. So, you know, where you had a quarter people were open defecating, then by the end it was, you know, close to 2/3, and that was just because of collapse. And we found that the subsidy, you know, made this not as bad. So, you know, among the poor, the people that received these subsidies in the communities where this was going on, you know, they were able to build toilets and use them. And, you know, we found that was effective. But for those other households in those communities, so the non-poor in those communities, there wasn't as much of an impact. So we didn't see spillover effects like we thought we might. But I think, you know, just being able to really rigorously study this in this context, and now, you know, UNICEF and USAID are at the stage where they're taking up these findings and thinking about next steps for their own programs and their own research. So this is another example where, you know, the research is done and we don't, you know, the impacts are still ongoing, right? And it will be the next, you know, the next few years really before, you know, some of the findings are really translated fully. But you know, I think we see a lot of potential. And just, I think, also recognizing that subsidies can be really effective in context. You know, a few years ago, subsidies were kind of a bad word in the wash sector. But now that, you know, I think that's changed. The pendulum has shifted on that one. And I think that's, you know, I think our study is also providing some evidence in that space as well.
Thank you so much, Dr. Peletz, for the great insights. Do you have any parting words for us?
Yeah, just thanks so much for your interest. And I think, you know, the water and sanitation sector needs there's still a lot to be done in terms of improving services in low income settings. And so thanks for your interest, and definitely, you know, we need more people working on these issues. So as a colleague of mine would say, come to this, you know, this field where, you know, I think that, you know, this is really one of the biggest challenges of our time, and also with climate change as well. You know, I've heard people say, you know, the climate issues are water issues, really, in terms of, you know, droughts and floods and other climate events. And so I think you know, this is going to be just a really interesting area going forward.